Welcome to the Simulation Center. This video is going to cover the simulation room and how you utilize it for simulation or for skills lab. This video is particularly going to be for intermittent catheter insertions and Foley catheter insertions on one of our male simulators. This is Freddy. He's one of the simulators we have, and I'll cover what that will look like for you in skills lab or simulation. So we're currently in simulation room 1, and it is set up for a simulation, but we're going to use it for your skills labs too sometimes. Sometimes your simulator may look like this. Freddy may look other ways when you come in. We're getting ready for a big trauma simulation, so he is all bandaged up right now, but he won't always look like that or look like he does now when you come into simulation. So when you come in, we do have gloves over here on the wall that you can use for simulation. We have a sink with running water, soap, and over here is our towel dispenser. We also have hand sanitizer at the sink so you can sanitize, cleanse your hands, use that for as you would in the live setting. With the simulator itself, currently he's not on, but when he is on, he does have carotid pulses, radial, I think he has brachial pulses too. He has tibial pulses as well. He does have chest rise, breath sounds, lung sounds, bowel sounds, and you can hear him breathing audibly too when you are in the room with him. This finger over here does have electronic components in it, so if you put this on his finger, you would actually get a SpO2 reading if it's calibrated. If his finger is not calibrated, you won't need it. But for just the Foley insertion, intermittent insertion, you won't need that. That would be more for simulation purposes, or if your faculty was wanting you to do a head-to-toe on the simulator itself. But typically in skills lab, or doing skills in simulation, you will be practicing your head-to-toe assessment on either a classmate or maybe a faculty member or me. Okay, so when the simulator is on, you will come into the room, talk to him. This one does have an ID band. You can verify his name and medical record number. In simulation, the ID bands do not have the birth date on them. We will not be speaking as a simulator for you in skills. We only do that in simulation. So when you come into the room, you're going to simulate coming and talking to your patient. You can talk to him like he is maybe nonverbal, or just, he might be able to hear you, but he's not responding to you. So just pretend like that's the situation, that you're coming in and talking to your patient. And go through those steps of what you would do to talk to your patient, verify, and that's how your simulator is going to run for skills lab. If it is a simulation, we would actually be probably talking to you as the patient. Okay. So when you are inserting a Foley catheter or an intermittent catheter, our supplies are always in the middle section, bottom section, the bottom drawer. You can find catheter supplies. You can find Foley catheter supplies. If you get into the room and there are no supplies in this bottom drawer, go over to this cabinet next to the wall, bottom, and this is where you will find additional supplies. There's towels, linens in this cabinet as well. For the Foley insertion and intermittent insertion, this should be the only things that you should need out of here. But we do have labels on our cabinets that tell you what is in each of the cabinets that has supplies in it for your use. So with inserting the catheter itself is packaged to simulate what you would experience in the real world scenario. So we open and pull the stuff out of the pack that is harmful to our simulator. So like the betadine can stain our simulator, so we pull that out and we dry the swabs. KY jelly, we can't use that on our simulators because it doesn't help you with inserting the tubes in the simulators. we do have mineral oil that's highly recommended to use when you insert a device, whether it's a Foley catheter, intermittent catheter, a breathing tube, an NG tube. You will want to use this because you're sliding silicone device against silicone simulator, so the mineral oil will help it to glide easier. But our packs, we have hopefully placed some lubricant in there for you. So when you're opening the pack, I'm not going to go through exactly how you insert this, the proper steps. I'm just going to cover how it looks with our simulator. So I'm just going to get some regular gloves to put on for this. I'm going to open it the packet here. There are sterile gloves in here, but if you open up the pack and realize, okay, this one's large, but if it was like, and thus we try to put larges in here, but if you feel like you need extra large, go over here to the cabinet, find your extra large and open them up. These are nitrile gloves, and because they are Catheter, and these are size small, medium, large, extra large. These are not sized like your 7, 7.5, 8, 8.5 sterile gloves. So when you use these, size up. So if you use a small, go up to a medium. That might make it easier to get the gloves on. The Betadine, you'll notice it doesn't look like it does in real life. You would open it up, and then you have your swabs. Like I said, they are dried, so you can actually touch the simulator with this, and you're not going to stain my simulator. They are dried, they are hard, so it is perfectly fine. Don't just touch the simulator and go through the steps that you would do to clean your simulator, I guess. We have a sterile specimen cup, we have waterproof drapes, and I do have labels on all of these. Usually, this helps with especially like our students that are learning, that are in the beginning stages of their nursing program. It helps them to realize the difference between fenestrated and waterproof drape. Here's my lubricant. It's in there. I can use it with my intermittent catheter. Now with the simulator, I'm just going to, he does have short side. So just remember, I'm not going to do this the proper way. I'm just showing you what it might look like, what it might feel like when you are in simulation. As far as the insertion of the catheter, our simulators do have bladders, so if we prep them, you can have a return on that. So be aware of that. And our simulators, you can turn and maneuver them should you want to. Turn them, just like log roll them, whatever you need to do with your simulator when you're in simulation or skills lab. So you're going to take your catheter, we're going to take, just remember, I'm not doing this like you would in real life. So right now, that cap's going to twist off. I'm going to squirt some into my hand. You really don't need a cc, about half a cc works, but if you feel like you need the whole thing, use the whole thing. You're not going to use you can't use too much. You can use too little, and then you won't be able to get the catheters in the simulators. So you want to make sure that oil is all the way on the catheter. And then when you're inserting it into the simulator, there will be a little bit of resistance. You can get past that resistance. It won't go. Okay, there it goes. It popped in there. But hopefully it popped in there. I'm going to cheat here so you can see what it looks like. So, see the catheter is coming through. So it will go all the way in, and if the bladder is prepped, you could have some output. So just make sure that your tray isn't under your simulator when you insert the Foley catheter. So that's pretty much it for how it will look with your simulator. I've got just a lot of mineral oil off of the simulator here. And then when you're finished with the supplies, instead of throwing them into the trash, if you will just put everything back in this tray here for cleaning up, cover the simulator, put the simulator back in the position it was in with the pants or shorts back on it. Make sure you got all the supplies. And then you can open this bottom drawer and under the sink on the right hand side, and there's a box in there, and just lay your used intermittent catheter, Foley catheter supplies in there. Put your spray back up here. If you didn't use it, that's fine. You have it there should you need it. And then now the Freddy here is ready for the next participant to come in and do their Foley catheter or intermittent catheter insertion. If you get to simulation and you have questions, please feel free to ask. There are no stupid questions. If there's any confusion, please let me know so that I can clear up any questions you might have about using our simulators for skills lab or for simulations. Okay. I hope this helps you with completing your skills lab or your simulation, and we will see you again, hopefully in another video. Okay, thanks.